Hey everybody, this is Dr. Bulow with Revive Upper Cervical, and today I'm hanging out with Sam and his mom, Dana. So we are in the office here, we're in April right now, and every April we kind of focus on pediatrics and moms and infants and newborns and, different health conditions, different pieces of advice, stuff like that. And we've been taking care of Sam now for how long?
About 3.5 months.
About 3.5 months. And if you wouldn't mind, explain to everybody, what was it that Sam had going on, and how did you come to find out about upper cervical?
Yeah, so Sam had 3 ear infections that were pretty severe.
And how old?
He started his first ear infection at about 3 months.
Yeah.
And he's now 10 months old.
Yeah.
And they were pretty back to back. I mean, we went through about 2 months where the ear infections were one after the other, requiring a lot of different antibiotics. In fact, for one of them, we required about 20 days of antibiotics.
Yeah, it's tough on a little baby's belly.
Yeah, the diarrhea was definitely an issue.
Yeah.
And a friend of mine, actually, who I work with, had recommended coming here and trying this out.
That's right.
Yeah.
That was, I believe, Lindsay and her little one Rocco. We did a video with them a few weeks back, actually.
Yes. Yeah, so she highly recommended trying it out. And we came, and I have to say I was a little anxious to come to a chiropractor with my little 3-month-old, 4-month-old at the time. And but what I think really reassured me was, first of all, seeing the techniques that you use.
Yeah.
And talking about reasons for why Sam might have an issue. He was a rough delivery. He was about 5 hours of pushing and forceps delivery.
Forceps, yeah. Anytime I always like to tell people, when you look at the soft spots, babies are designed to be pushed. But anytime you start pulling aggressively, forceps, cesarean sections, vacuum extractions, all those things, it has the potential to create some stress on their neck. And,
yes.
But what was your experience when you first came in? How was it? Because I don't think you're alone. I think a lot of moms have that fear, and I think even adults do. When you talk about someone touching somebody's neck, and it's kind of like we have a primal fear of our protection of our neck. So what did you observe? What was it like seeing Sam get taken care of here?
Absolutely. I think my thought was, as long as it doesn't do any harm, and we're starting out.
First do no harm. Yep, that's a good one.
So as I watched you examine him, I was immediately very reassured how incredibly gentle. In fact, I handed him over to you, and he smiled immediately.
That's right.
And looked very calm and happy the whole time. So I thought, well, even if it doesn't do anything, it seems like a pleasant experience.
That's right. That's right.
And it seemed so gentle and minor to start with, which was really reassuring. So I left feeling good that we were going to try this and see how it went.
And then how has it been? Like, how was Sam doing in the first few weeks after care, and how's it been in the last few months?
Well, I'm happy to report since we started treatment, he hasn't had a single ear infection, which is pretty incredible. We were just discussing how myself and his pediatrician were saying most kids who get that many ear infections back to back usually end up with tubes.
Yeah.
And my goal was really to avoid that, and also to avoid all those antibiotic exposures. And he certainly had colds, and it was every time he got a cold, he got an ear infection.
Right
it
up to
was
the ears.
immediate. And he goes to daycare, so I can't expect him not to get colds. And he certainly has had his share of colds since we started coming here, but no ear infection.
That's pretty awesome.
So I keep taking him to the pediatrician to check his ears, and she said they look clear.
Yeah.
Which is wonderful. Huh. So, and we were just discussing, he had a lymph node back here that was very big when we first started coming, and it's completely gone now on the side of his ear infection. So, I wonder if just that drainage has really helped relieve things.
It's pretty cool when things are running the way they're supposed to. One of the things I always point out is that, newborns are like brand new cars. They're right off the lot. You know what I mean? Like, they have brand new parts. And so barring a legitimate genetic disorder, if we can just get things back in line the way the design is, that it's just designed to do that. It's designed to take care of it. Like, an ear infection once in a while, or the immune system has to learn how to deal with things. We've all had a runny nose in our past, but not repetitively and not continuously over time. And so, like that pediatrician mentioned, most people that have it repetitively, usually something's wrong on the inside of their system, and they end up needing more serious drugs and surgeries. And the whole mission is to say, hey, look, let's take a look. Let's see if there's something keeping them from running right. If we can just fix that, then maybe they don't need to continue down that path of degeneration and instead go on a path of restoration, So That's awesome, man. I really appreciate you taking the time, Dana.
Of course.
And I always like to say, any last words for folks watching?
No, I would just say, if you're hesitant, again, like I was a little bit thinking, cervical manipulation of the neck of the
That's
baby.
right. I don't even like that term.
Right. But that's, I think, what comes to mind for some moms when you hear this. I can tell you I was incredibly reassured from the second I came in, and really glad that we gave it a shot.
Yeah. And there is no, and I should say that, there's not that there's anything wrong with it, but in this clinic, there is no turning, twisting, cracking, popping in the neck at all. It's a little impulse behind the ear, sometimes with my hand, sometimes with an instrument. This instrument here will sometimes use, it looks a little scary, but actually it provides an impulse that you can barely see my finger move right now because it's a 1/16 of an inch. So it's literally like a slight little tap on the upper neck bone. But there is no turning. There's no forceful movement. It's just a light little, almost like a vibration. So it's a piece of cake. There's no risk really at all in what we're doing here. So
He seems to enjoy it.
But yeah, give us a call if you need any help. And I always, again, if you're still hanging out with us at this point, please share this video. You never know who could be watching. You yourself may not have any kiddos that have any needs, but your friend or neighbor or colleague who you're connected with might. So please feel free to share. Looks like he's ready to go.
He's ready to roll away.
So we're ready to go. All right. Thanks again, Nana.
You're welcome.
Thanks for hanging out with us today. Yeah. All right, guys. We'll see you next time. Bye now.